There are 76 cases, all locally acquired across Victoria. 45 of those are linked to known outbreaks, with 31 of those cases under investigation by our public health team. We'll provide you with as much information as we can in show release later today. 36 of today's cases were in isolation for the entirety of their infectious period. That means we now have a total of some 841 active cases, 836 locally acquired and 5 overseas acquired. On vaccines, some 32,162 vaccines were administered yesterday in our state clinics. That is an 8% increase on the same day the week before. So I thank each and every one of those people for making an appointment and for turning up and getting their shot. That's never been more important than driving up those first and second dose vaccine rates, and I'll come back to what vaccination coverage means for all of us in just a moment. This weekend just passed, we saw a 20% increase in the number of people getting the jab. So there's a lot written and a lot said about people being hesitant. That's not our experience. I think many people are very keen to get vaccinated as quickly as possible, and I'm deeply grateful to each and every one of them, and of course to the teams of people in our state clinics, in our pharmacies and in our GP practices who are all working very hard to get that job done. Our state clinics remain some of the most successful anywhere in the country per capita, and just in terms of the sheer volume of work that we're doing, it's making all the difference, and we'll continue to open more of them, to look at new and innovative ways of getting vaccines into people's arms, and there literally are millions of people that have come through our system, and we know that as more vaccines become available throughout September, October and November, we will reach those national plan targets of 70 and 80%, and that'll be very meaningful to the way we live our lives. Can I just report to you that there are 52 people in hospital, 16 are in intensive care, and 15 of those 16 are on a ventilator. Just so that no one's in any doubt about the fact that this is an outbreak and is moving to become a pandemic of the unvaccinated, there are very few people in hospital that have been either first dosed or fully vaccinated. Very few indeed, and that's not just an experience here, but I think Sydney is reporting that phenomenon also. The other thing to note as well is that this virus is going to the unvaccinated. That is to say, it is finding younger people who are not yet vaccinated, and it is making many of them very unwell. The 15 people that are on ventilators in our Victorian hospitals are aged between 38 and 72. We analysed yesterday the ages of people in hospital and in ICU. The median age of Victorian COVID patients in hospital is 49, not 99. Not that that makes any difference in terms of how challenging it is for someone to be sick and how we all have to work hard to care for them, but no one should be in any doubt. This is not those that are in the last chapter of their life. We are talking about people who are altogether younger than that. Median age of COVID patients in hospital in Victoria is 49 years of age. The median age of those in ICU is 48. More than half of COVID patients in hospital are under 50, and 50% of COVID patients in ICU are in their 40s. Similar trends, I'm sure, are holding up, sadly, in New South Wales. So this is affecting people of all ages, and it's making younger people quite ill because that's where the majority of the infections are. Now, that's the numbers of the day. I'll get Brett to go to the different links in those chains of transmission and the outbreak report in just a moment. And then Dr. Stephen Warrilow, who is the Director of ICU at the Austin Hospital, has joined us today to share some experiences of treating many COVID patients last year, and to hopefully bring into sharp relief and focus the challenges of having very large numbers of patients in hospital and the challenge of having significant numbers of people in intensive care. But that'll be in just a moment. Before that, can I just make a few comments about where we find ourselves right now? As a state and as a nation, we can cope with a pandemic of the unvaccinated if that unvaccinated group is quite small. That is to say, we will cope with unvaccinated people becoming infected and becoming sick when we have reached the 70 and, most importantly, the 80% vaccination target. Today, as I stand here now, Victoria and the nation has only 35% of people double dose covered. 35%, not 80% vaccinated, 35% vaccinated. The notion of trying to cope with a pandemic when you are open with very few rules, when so few people are vaccinated, we know what that would mean. It would mean not hundreds of cases, it would mean thousands of cases. So as I said on Sunday, and as I think Victorians know, these numbers are too high for us to open up. If we were to open up, this is the thing with Delta. You either aim for zero or a very low number and therefore keep the numbers low, or if you try other approaches, the numbers get away from you very, very quickly. So some people have been critical about our focus on zero. Well, you either aim for zero or very low numbers, or you finish up with many zeros. Sadly, let's not forget that the New South Wales outbreak started with just a handful of cases. They're now reporting more than 1,000 cases a day. We have to aim to keep these numbers incredibly low. If we can achieve zero, that's a terrific outcome. If we can't, then we are all the better for having tried to drive the numbers down as low as possible, because this is the key point. Delta infects so rapidly that it's not a choice between 0 or 500 cases a day. It's a choice between very low numbers of cases and thousands of cases. It's very hard to find an in-between. No country in the world has been able to do that. And I know there is some commentary about the fact that case numbers don't matter. Well, they'll matter less once we have 80% of our country vaccinated, but they matter a lot when you only have 35% of the country vaccinated. Because the doctors tell us that 10% of cases will become patients in hospital. Not all in ICU, but anybody who's in hospital with this virus is unwell. They are sick. They would prefer not to be there. There will be a percentage that finish up needing the highest level of care, and Stephen can speak to that in just a few moments. So it's not like we have easy choices and really hard ones, and we're choosing to go with the most difficult choice, the choice that's having the greatest impact. There are only difficult choices. There are only difficult options with Delta. You either aim for very low numbers or you will in fact have very high numbers. That's the simplest way I can put it. I remind people there are more than 1,000 cases a day in Sydney and they are locked down too. It's not like they're open, they are locked down as well. And their hospitals are under enormous stress. We wish them well. I wish if we didn't have our outbreak and the challenges we face, then we would be sending help to them. We just can't do that because we have to be taking care of those who need us here right now, and we need to continue to work to run these cases down to the lowest possible number.